Hi, let's answer the following questions. What is creatinine? What is eGFR? And what's the blind range of creatinine? Serum creatinine can be used to estimate the function of the kidney, since creatinine is excreted by the kidneys. This means the lower the serum creatinine, so in the blood, not the urine, the better the glomerular filtration rate, and vice versa. But where does creatinine come from? Creatinine is a metabolite from our muscle tissue. Our muscle cells use creatine phosphate as an important energy source to enable great force and quick action. Creatinine is the breakdown product. Every day, about 1 to 2 grams of creatinine builds up in our body, and the same amount is usually excreted in the urine. This means that creatinine concentration in the blood should remain the same during normal kidney function. Therefore, there is a normal range of creatinine in serum. Normal levels range from 0.5 to 1.2 milligrams per deciliter. Notice the change in units. It's milligrams per deciliter. The exact numbers depend on muscle mass, age, and sex, with men having slightly higher levels in serum. So, what does an elevation in creatinine mean then? An elevation of serum creatinine indicates a reduction of glomerular filtration, since the kidney isn't able to excrete creatinine like it's used to. There are either chronic reasons, which are summarized under the name chronic kidney disease, or CKD, or acute dysfunctions of the kidney, named acute kidney injury, AKI. CKD usually leads to a slower increase of serum creatinine, whereas AKI is usually marked by a quicker rise in serum creatinine. Usually inside the glomerulus, creatinine is filtered freely into the tubal lumen and can then be found in the urine. When GFR drops, creatinine inside the urine drops as well and is elevated inside the blood serum. So, how would you then estimate or determine kidney function, so the glomerular filtration rate? There are actually two ways, and let's start with the urine. Do you remember how much creatinine was produced and supposed to be found in the urine daily? It's about 1 to 2 grams in 24 hours of urine. Let's get a bit more precise here. Women should excrete daily not less than 1 to 1.3 grams per day, whereas men daily not less than 1.5 to 2.5 grams per day. This method of GFR measurement is also called endogenous creatinine clearance, or just creatinine clearance, CrCl. It's usually used in hospitals, since it's difficult to perform this method in outpatient setting. It has, however, the advantage that it is very accurate. What is the other method then? With the help of serum creatinine value, we can estimate the GFR, which is also called estimated GFR or just eGFR. It's not quite as accurate as the CrCl, but much easier to perform, since you only need to draw blood. To counteract inaccuracies, labs use the so-called CKD-EPI equation. It takes into account that creatinine values fluctuate due to muscle mass, sex, age, and ethnic origin. What is the relationship between creatinine and GFR? Which creatinine values correspond to which GFR? We best look at this in a diagram. On the x-axis, we recognize the glomerular filtration rate GFR in milliliters per minute, and on the y-axis, the concentration of creatinine is plotted. The further right a point in the picture is, the higher the GFR, and thus the better the kidney function. The higher a point in the picture is, the higher the creatinine value in the blood. Note, in the blood, not in the urine. What does the curve look like physiologically? At the normal creatinine value, we take an average value of 1 mg per deciliter in serum. The GFR should be about 120 milliliters per minute. We take numbers here from a physiology book. Note that the numbers look different for each person. This is what the curve looks like. At the beginning, with decreasing GFR starting at 120 milliliters per minute downwards, it has a flat course, which means the creatinine concentration in the serum changes only slightly. Only from a GFR of under 60 milliliters per minute does the creatinine rise, and now even stronger. So important, remember, there is no linear relationship between GFR and creatinine. This is what a linear correlation would look like. We talk about the reason for that in just a minute. Think briefly, what does this course mean for clinical practice? When do we discover patients with kidney dysfunction? Only from a GFR reduction of about 50% can kidney damage be detected by a blood draw. At higher creatinine values, even a small increase means a much stronger decrease in GFR. We can thus not detect early reductions of GFR, for example in diabetic nephropathy, a form of chronic kidney disease, CKD. Therefore, the range of GFR between 120 to 60 milliliters per minute with creatinine of about 1 mg per deciliter is called the blind range of creatinine, since we cannot yet recognize damage of the glomeruli. So what causes this blind range, and why isn't there a linear relationship? Creatinine is first freely filtered in the glomerulus and physiologically also slightly secreted in the tubal system, so that under normal conditions 90% of the total excreted creatinine comes from filtration and about 10% is secreted in the tubular system. In many diseases, initially only the glomerulus breaks down and the tubular system remains healthy. The 10% can now increase so that creatinine is filtered less but secreted more, and in the end, serum and urine creatinine values remain the same, even if the GFR drops. This compensation is exhausted at a reduction of GFR by about 50%, so about 60 milliliters per minute. Then the curve rises, as visible in the diagram. To recognize this blind range, one would measure another parameter named Cystatin C, which will be explained in this video. Let's briefly summarize. Creatinine can be determined in blood and urine to determine the GFR. Daily, 1 to 2 grams are formed and also excreted again, so that there is a normal value in serum of about 0.5 to 1.2 milligrams per deciliter. The numbers depend on muscle mass, age or sex and are taken into account by the CKD-EPI equation. A rise in serum creatinine goes along with a fall in urine creatinine and shows the reduction of GFR. Only from a reduction of 50% is creatinine sensitive enough to represent this kidney impairment. If you have any questions, feel free to write a comment down below, and I see you next time.